Good morning, everybody. Thank you very much for coming along, and I'm very glad to be joined this morning by the government's Chief Medical Officer and Chief Scientific Advisor. Today we've published the Coronavirus Action Plan, setting out how all four parts of the UK will take all necessary and reasonable steps to prepare for and tackle this outbreak. And the plan has four strands: containing the virus, delaying its spread, researching its origins and cure, and finally, mitigating the impact should the virus become more widespread. That is, contain, delay, research, mitigate. And let me be absolutely clear that for the overwhelming majority of people who contract the virus, this will be a mild disease from which they will speedily and fully recover, as we've already seen. But I fully understand public concern, your concern about the global spread of the virus, and it is highly likely that we will see a growing number of UK cases. And that's why keeping the country safe is the government's overriding priority. And our plan means we're committed to doing everything possible, based on the advice of our world-leading scientific experts, to prepare for all eventualities. And let's not forget, we already have a fantastic NHS, fantastic testing systems, and fantastic surveillance of the spread of the disease. We will make sure the NHS gets all the support it needs to continue their brilliant response to the virus so far. The plan does not set out what the government will do. It sets out the steps that we could take at the right time and on the basis of the scientific advice. Our country remains extremely well prepared, as it has been since the outbreak began in Wuhan several months ago. Finally, crucially, we must not forget what we can all do to fight this virus, which is to wash our hands. You knew I was going to say this, but wash our hands with soap and water. And forgive me for repeating this, but there will be people first tuning into this for the first time. Wash your hands with soap and hot water for the length of time it takes to sing Happy Birthday twice. It's simple advice, but it's the single most important thing we can do, as I think our experts would attest. But at this stage, and with the exception of all the points that I have just mentioned, I want to stress that for the vast majority of the people of this country, we should be going about our business as usual. And on that note, I will hand over to all of you to ask questions to the Chief Medical Officer and the Chief Scientific Advisor. And I'm going to go to you guys in the media, Laura Koonsberg from the BBC.
Thank you very much, Prime Minister. First of all, Prime Minister, are you telling people today that sooner or later all of our lives are going to be disrupted somehow? And a question to the Chief Medical Officer and the Chief Scientific Advisor, if I may. Do you believe at some point this virus will be bigger than any effort the government can make to try to contain it? And to the Chief Medical Officer, what is your best guess, if you can, of how many people will actually get this disease, even bearing in mind that for the majority of people it's mild and won't do any long-term harm?
Well, Laura, I think the answer to your question is, I'm afraid at this stage it is just, I think, too early to say. But I'll hand over to our experts on that.
There's a key point about timing here. And there are a number of measures that could be taken to try and reduce the peak and flatten it a bit so we haven't got such a sharp number of people at any one time. And the question is at what time to implement which measures. If you do it too early, you end up with a lot of people having disruption, a lot of societal disruption, at a time you're not getting benefit. And you also ask a lot of people to go on for a long time doing this Whereas what we really want to do is to implement whatever's necessary at the time, depending on how the epidemic goes, at the right time, over a 12-week period or so is probably what's going to be needed to do it. So we don't want to go too early. And those measures, of course, are the ones that are laid out in the document. It doesn't mean all of those need to happen. It depends on the nature of the outbreak. We're modelling all of the interventions at the moment and trying to look at what the right combination is at what stage. And of course, central to all of this is making sure that we protect the vulnerable. And the highest risk groups are the elderly and those with pre-existing illness. And those are the ones we've got to make most care to protect during this. And as the Prime Minister says, the vast majority of people will end up with a mild illness. So the timing is critical, and it's not now. And we're looking very carefully at when the time's right and what the combination of things are that are going to make the biggest difference.
Thanks, Ron. Sorry.
Just to add on from that, the first thing is you asked me specifically about the best guess on numbers. There are certain things we know now, and I think we're reasonably confident that overall, probably around 1% of people who get this virus might end up dying based on the Chinese experience. Now, to be clear, what that therefore means is 99% of people will not. And if, as I think is entirely possible, a higher proportion than we currently are aware of get the infection without any symptoms, in fact, that mortality rate will go down. But let's take 1% overall as the current reasonable figure. It goes up a bit in people who are older or more vulnerable, as Sir Patrick said. It will be much lower than that in younger people who actually have no other health problems. So that bit of the information we know for sure. The bit of information that we don't know, there are two bits that are critical. The proportion of people who have no symptoms at all, and that's because we don't currently have tests which can work out if someone's had an infection with no symptoms at all. So maybe, for example, in China, a very large number of people have been infected with no symptoms and are not being counted in the numbers. So we don't know that. And the second thing we cannot be sure of is what proportion of the population can get infected. Now, it will not go above 80%, so for planning purposes, of course, we go up to the highest rate that it reasonably could. But in reality, my view and Patrick's view are that the proportion of the population who get infected is likely to be lower than that and probably a lot lower than that. So I think putting an overall number is largely speculative, but those are, I think, the key things it's important for people to understand.
So if you look at Wuhan, it's clearly not 80% of the population that's infected with a 1% mortality rate. And so we can learn from that, but this is likely to be lower than that. Of course, things could still change in Wuhan, and that could turn out to be different as they release some of the containment measures, but it's definitely a lot lower than that. And so I think what we're doing is building on the reasonable worst case scenario, which is the one that Chris has laid out for planning purposes, which is the appropriate thing to do, and then looking very carefully at how this evolves and what the numbers might turn out to be.
Thanks, Patrick. Rob.
Couple of questions. The action plan you published today says there's a possibility that a fifth of working people will be off work during the peak period. Prime Minister, what will you do to make sure that those who are ill don't also suffer hardship, particularly those on low pay? And secondly, we're still in the containment phase. What would we have to see here to move into the phase of simply delaying an epidemic?
Well, thanks, Robert. On the issue of statutory sick pay and the risks that the workforce could conceivably run in that worst case, reasonable worst case scenario that you described, we're going to keep all options under review, but we're well aware of the issue.
In terms of moving from containment to delay, the first point to make is that most of the things that we do to try and help contain the virus, like finding the early cases and isolating them, also are very important for delay. So they serve both purposes. There will come a point potentially, and not definitely, but there will come a point potentially where the amount of transmission either in the UK or equally likely, everywhere in the world, is so great that actually the idea of containing, which is to say essentially getting rid of this virus completely, ceases to make sense. We have not reached that point, but we could reach that point. And at that point, we will move over to saying, well, that bit has stopped, but to be clear, many of the things we're currently doing will continue because they also have a role in delay.
And maybe just to add one thing on that, which is, as Chris rightly says, this is an international call when it moves from contain to delay. But it's possible, when we reach a stage that we think we can't contain here, other countries do it, that we might, as a group of countries, decide to do something. So those are the two areas that we need to keep an eye on.
Thanks, Beth, really explain.
Thank you. A couple of questions, if I may. Yesterday, the Scottish Chief Medical Officer said that up to 4% of the population might have to be hospitalised. Do you accept that figure? And if so, how will the NHS cope with nearly 3 million people being hospitalised? And just a question for the Prime Minister. As Robert was saying, 1 in 5 workers could be off work. Your document says in worst case scenario, the police might have to be redeployed just to deal with serious crime and maintain public order. Will you draft in the army if necessary? And can you promise citizens that in the midst of all this, you can keep them safe? Thank you.
Yes, thanks very much, Beth. And let me deal with both those important points. On the NHS and the potential pressure on the NHS, I think we have a fantastic health service, and it's well capable of handling the most tremendous pressures, as everybody knows. I think one thing it will be important for us all to do, if the virus moves into the kind of stages that our scientific advisors have just been talking about, it will be very important for everybody to think not only what we can do to prevent the spread of the virus individually, but also what we can do to avoid too much pressure on the NHS. So when it comes to using services such as GPs or 111, and it will be quite important to be self-restraining where possible. Because like I say, most people will unquestionably get through it. And on your second point about the police and the army, there are long-established plans by which the police will, obviously they will keep the public safe, but they will prioritise those things that they have to do, and the army is of course always ready to backfill as and when, but that is under the reasonable worst case scenario. Andy Bell, sorry, 5 News.
Andy Bell, 5 News. Just to return to the idea of pressures on the NHS, though, I mean, people will struggle to believe that the NHS will be able to cope seamlessly when we all know the pressures this system is under. Can you give us an idea of what will not happen in the NHS? What operations will not happen, for instance, what treatments will not happen, if we move to a stage where you can potentially have tens of thousands or hundreds of thousands of people having to be treated in hospital?
So one of the reasons that we are so keen to delay is we're trying to push as far as we can the peak of the infection, if it occurs, out into the period of the year when the NHS is better able to do things because the other infectious diseases of winter are not there. So that is one of the key principles of the delay strategy, is pushing out into the late spring and summer period. Now, when we get there, there are 3 separate sets of things that we are going to need to do. The first of which is to take measures or consider measures which are going to reduce the peak of the infection, so the proportion of people infected to get at the same time is smaller. And these are the kinds of decisions around social distancing and other areas which will need to present to ministers with a menu which will be looked at, scientifically modelled out, what is the combination of things that can pull down the peak that will make the difference between what the NHS normally can do and this peak as small as possible. That's the first thing. The second thing we can do and must do is to isolate from the virus, but not from society. And this is how we do this, is a key thing. Older people and people who are vulnerable for other reasons. That is both very good for their health, and it also will reduce the pressure on the NHS. And then the third thing will be to reconfigure the services to deal with the peak, which will be a relatively short one in the sense of it is a number of weeks. So we will see this coming from the modelling, and what we will try and do is, in a sense, be prepared to slow down or postpone anything that is postponable, and then deal with the peak that we find ourselves with at the point it arrives. And you know, as a doctor myself, as Patrick's also a doctor, this is normal medical practice, is to actually basically you adjust what you do clinically to the particular group of problems you've got in front of us. And that's what the NHS will do, as any group of doctors would do, any group of nurses would do.
Thanks very much. Joe Murphy, Evening Standard? Not yet, filing, different career, Daily Mirror.
Career from the Mirror. A couple of questions to different people, if I may. The CMO and the CS, I'm just wondering what specific advice you might have for people in care homes, because obviously they're both elderly and vulnerable, whether that would affect visitors perhaps, or whether you would suggest that individuals should stay within the care homes. And the Prime Minister, can you give us any more detail on the local resilience plans that you've got in place? The document talks about government of the UK and the devolved administrations dealing with councils to help with things. For example, talking about an increase in deaths arising from the outbreak. We've all heard sort of scare stories, horror stories about morgues in Hyde Park and so on. Can you give us some reassurance about what plans are in place to make sure that if more people do die, it's handled with dignity?
Sure. So just quickly on that one, Pippa, obviously there are long-established plans when we're working with local resilience forums to make sure that everybody gets dignity that they deserve, and there are long established plans to make sure that happens.
On care homes specifically, we will give some very specific advice on care homes, but one of the things we're keen to avoid, this is going back to Patrick's point at the beginning, is doing things too early. Because if you do them early, you get no benefit from the epidemic, but what you do get is a social cost. So what we want to do is give the advice at the point we think it's going to have an effect on improving the lives or reducing the chance of infection of people in their care homes. And at that point, we will give specific care home advice.
Thanks. Kate Ferguson, Sun.
Hi, Prime Minister. What words of reassurance? What words of reassurance do you have for Brits sitting at home, worried about what this means for them, that they can get through this crisis and that Britain can get through this crisis?
Well, thanks, Kate. I just want to repeat what I said at the outset. There are some very simple things that we can do to protect ourselves and to stop the spread of the disease. Number one, wash your hands. I don't want to repeat how to wash your hands. But the second thing is really just to repeat what the CMO and the Chief Scientific Advisor have told us. This is overwhelmingly a disease that is moderate in its effects. People recover speedily and well from it. That's what we're seeing in the overwhelming majority of cases. And I have no doubt at all that with the scientific advice that we have, with the levels of preparedness that we have with our fantastic NHS, our ability to test and to survey the spread of the disease, that this country is going to get through coronavirus. No doubt at all, and get through it in good shape. But I don't know whether anyone wants to add anything.
I think those are the things. I mean, there are some things to do now which have been clear, and the other things we will give advice on as they come at the right time. And I want to re-emphasise this point. You do things at the wrong time, you end up with an awful lot of disruption, and you potentially make them less effective when they come in because people have stopped doing them by that stage because they can't see the point.
Correct. Gordon, right.
Thank you, Prime Minister. The document talks about giving help to businesses facing short-term cash flow issues, particularly if they're struggling to pay their tax. But if a business has a fifth of its workforce off and it's potentially then facing huge problems with its cash flow, what other help can the government give to businesses? Are you considering short-term loans, interest-free loans, that sort of thing to help see businesses through that period?
Well, the BEIS, Alok Sharma, we are now engaging with business of all kinds to ensure that they understand what the reasonable worst case scenario is that you describe, and of course making the necessary preparations to ensure that they have the protections that they need. But I don't want to go into more details at this stage, because as I think we're trying to make clear this morning, we're taking each step as it comes. Jason.
Thank you. Jason Goes from the Daily Mail. It sounds like you're bracing people for some potentially big sacrifices here, covering for people at work for extended periods, suspending their social lives, maybe being quarantined at home, almost a kind of wartime effort. I mean, do you think we still have, you're a student of these things, do we still have that sort of bulldog spirit to fight this on the beaches, as it were? And while I've got you, can I congratulate you on your impending fatherhood and ask whether you plan to set an example to new fathers by taking paternity leave?
Right. Well, on your first substantive point, Jason, both substantive points, I do think that this is a national challenge, and I do think that we are faced with something that could be, the potential is there for this to be something that our country has to get through. But I've got absolutely no doubt that we have the resources, we've got the health service, we've got the expertise to do it. And I'm very confident that the British public understand that. I think the British public can see exactly what the balance of risk is. I think they can see, because I think we're getting some very, very clear advice. I think they're getting a very clear picture of how we all need to behave, and I think we'll get through it, as I say, in very good shape. And on your second question, I think the answer is almost certainly yes. I can't remember what the question was, but I know. Paul.
Paul Wall from HuffPost. Prime Minister, what advice have you got for parents who think that their children may well be suffering from school closures this summer in a few weeks' time? Do you or both of your advisors want to give a bit more explanation on that?
Yes. Well, I mean, on school closures, we don't think that schools should be closing in principle. We think, if possible, schools should stay open, but that school authorities should follow the advice of Public Health England. That's where we are.
Shall I add something to that, Prime Minister? I mean, I think there are probably two things to say in addition to that. The first is that there's no evidence at the moment that children are particularly badly affected by this virus. In fact, quite the other way. Currently, the evidence from China, at least, would imply that children have much less of this disease. That's either because they're getting it less often, or that they are getting it, but it is much milder. So the first reason to close schools, which is this is particularly dangerous for children, which some infections are, would not be a sensible reason in this case. The second reason is that in some epidemics, it is useful to actually close schools as a way of damping down the epidemic significantly. And one of the things that Patrick, with the Scientific Advisory Group and experts, is doing is modelling out, would that help sufficiently in this particular epidemic, if it were to be done as a way of pulling down the peak of the infection to justify the considerable burden, including, I have to say, to the NHS, which would start to lose healthcare workers who had to look after children at home. So these things are difficult balancing acts, and the Scientific Advisory Group are working through this. So Patrick might wish to add a bit how they're intending to do this.
Yeah, so we're modelling what the impact of school closures might be. And of course, it's wrong to do that in isolation. So there are several measures you could take to try and limit this, and other countries have taken various measures. And the school closures needs to be part of that. So there's no point looking at it in isolation and saying just do that. We know that's not effective, or not very effective. It has to be done as part of other things. And when you put the other things together, actually, where school closures fit in that, compared to the disruption and so on, and given that children aren't affected, may be rather lower down than you might expect. So we're modelling that at the moment, and we will come up with advice around which the interventions are that make the most impact, which combinations make the most impact, and what the potential societal disruption associated with that is, in order that ministers and prime ministers can make decisions around those.
That's very, very helpful. Thank you. Chris Smith at Times. Yes.
Thank you, Prime Minister. When you're considering some of these more drastic measures, whether it's school closures, restricting gatherings, other things you'll have under these powers that you're planning to introduce, you may be guided by scientific evidence, but this is fundamentally a political choice. The 2011 pandemic plan was much more laissez-faire, saying no reason to cancel mass gatherings. That's now shifted. Can you tell us a bit about how you personally will make those judgments? What principles will you guide by making the trade-off between disruption and mitigating?
Well, it's not going to surprise you, Chris, if I say that the principle that will guide us in all these decisions is the scientific advice. So when it comes to calculating the trade-off that you identify between efficacy and disruption, it's the science that will help us to take the decision. Theo Usherwood from LBC. Sorry, you're not Theo. I think you're LBC then. Good. Okay.
Thank you, Prime Minister. Ben Kentish, LBC. Prime Minister, in the document published today, it mentions that plans are in place for what it calls a severe prolonged pandemic, as experienced in 1918 with Spanish flu. How seriously is the government taking that prospect, and how likely is it to get that bad?
Well, thank you very much. I think probably on the sort of statistical possibilities of that, of a 1918 style epidemic, I'd probably ought to pass to Patrick or to Chris.
So the first thing to say, this looks very different from the 1918 pandemic in that 1918 affected lots of children and young people, and this largely, in terms of serious illness and death, affects elderly people and people with pre-existing diseases. So it looks very different in terms of that. In terms of the scale, as we've said, at the moment, we've got a reasonable worst-case scenario. We think, for all the reasons that I laid out earlier on about when you see what's happening in Wuhan, actually the scale is less than that, and it looks like the numbers should come down in terms of the percentage of the population affected, and it may alter the perception of the mortality rate as well. So that the reasonable worst case scenario is based on pandemic flu, and the data that we now get and the information we get is suggesting that actually those numbers can be modified. There are some differences, it lasts slightly longer, so there are some changes. What we think in terms of the profile of an epidemic, and this may change as we get numbers from Europe and the UK, is that you can think of it as roughly 2 to 3 months from an outbreak of sustained person-to-person transmission, 2 to 3 months up to the peak, and 2 to 3 months after the peak to decline again is the timeline that we'd be thinking of.
Okay, thank you. Lisa? Mater Hall Express.
If people think they have this illness, they have to self-quarantine. They're going to need food. What practical advice can you give about people keeping their larders and fridges stocked without triggering panic buying?
Well, I mean, I can tell you, we have a behavioural subgroup of the SAGE that we talked about, and the first thing to say is I think the advice from the behavioural scientists, actually people don't panic, they take what they seem like logical decisions based on what they believe. And the advice at the moment, there's absolutely no reason to be doing any panic buying of any sort, or going out and keeping large supplies of things. Clearly, there will need to be measures in cases of household quarantine for making sure that food is in the right place at the right time. But we imagine that that could be a rolling case of household quarantine if that measure becomes necessary. And clearly there will need to be things in place for care homes and so on at that point, if that decision is made. And obviously and this goes back to the point Chris made earlier on, if you take the issue of looking after the vulnerable and having issues of social distancing there, what you don't want to do is end up with a position where people truly become socially isolated in the wrong way, and you definitely do not want situations where people are afraid to come to their front door for fear of catching something. So there will need to be measures put in place if those things become necessary.
I think that the other thing which is very clear from the behavioural science is that the response of, and this is a scientific point, not a general point, is that the response of the British public to disasters and emergencies is extraordinary outbreaks of altruism. And that is actually the more likely response of the public.
Well, that is absolutely true. Yes, please, sorry.
Thank you. Jane Merrick from the Eye newspaper. Excuse me. Given that they are in high-risk groups, the elderly and the ill are likely to feel quite frightened today and may not be reassured by the 1% rate and by hand washing. What can you say to them to feel slightly less frightened about this?
Well, thanks, Jane. Obviously, just repeat what Patrick and Chris have already said about prioritising the needs of the vulnerable and the elderly. But on your statistical concerns, perhaps yes, Chris.
And I think the thing to be really clear about is even for the highest risk group, the great majority of people will survive this. So if you look at the Chinese data, if you take the very oldest people, the great majority survive. So it is important to stress that. And if you're talking about the low risk groups, the rate of mortality is well below 1%. So I think there's always a danger people think this has actually got a higher risk than it actually has for them personally. And I think the second thing to say is clearly the point of the NHS's approach to this is going to be to prioritise those who are in greatest need of treatment. And that is the way the NHS will respond to this at all stages of this epidemic, which will have a beginning, a middle and an end. And we will just respond slightly differently in those three phases.
Thank you very much.
Thank you. It's Emily Ashton at BuzzFeed. I just wanted to ask about holidays. There will be lots of people out there who've booked spring and summer holidays, not just far afield, but to Europe, and they're really looking forward to it. Should they be preparing to cancel those holidays and staying in the UK? Or do you think those holidays can still go ahead?
Well, a lot depends on where the outbreaks are. So at the moment, the outbreaks are across Europe and across most of the world in some form or another. And they're contained in many places, but are becoming uncontained in some places. And so, again, it depends on the stage. Because once the epidemic is everywhere, then actually restricting travel like that makes no difference at all. And at the moment, we're certainly not recommending any change to behaviours in relation to that. And as it grows, if it grows in the UK, then of course it doesn't really make any sense to say that you're at more risk somewhere else than you are here.
Shall I just add one point on that, because it is a very important point. The first reason for people having advice on travel is to do with, is it actually going to transmit the virus around? And by the later stage, it simply isn't, because it'll be everywhere, so it makes no difference. The second stage, and this is only relevant to a few places, is if you happen to be in a place with a very weak health service, at the peak of their epidemic, weaker than the NHS, that obviously might be more problematic. And this is particularly an issue for people who are older or have pre-existing health conditions. So I think in those situations, they just might want to think through the practicalities of being in a place which has a health service less strong than the NHS. But that isn't a point about moving the virus around, it's simply a practical point.
Thanks. Yes.
Thank you. Prime Minister Kevin Schofield from Politics Home. We understand that the Health Secretary has spoken to social media companies about potentially posting fake news about the coronavirus. What would be your message to the likes of Twitter and Facebook who might be allowing these types of posts?
Well, I'm sure that it's exactly what Matt would say. You know, we've all got to be very responsible, and you know, the media has a very important role in this, particularly the social media and electronic media of all types. I'm sure that they will want to convey the right messages and convey the right balance of risk. And there are lots of questions over here. Yes, yes.
Victoria MacDonald.
Oh, sorry, Kate. Victoria. No, go on.
Right, so Victoria MacDonald from Channel 4 News. There's been a bit of confusing advice about things like shaking hands.
Yes.
And I'm intrigued to know whether you've developed a personal policy yourself. So next time there's a visiting dignitary and you're standing on the doorsteps of Downing Street, are you going to shake their hands? And if not, how are you going to avert an international incident?
No, well, Victoria, I can tell you that I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody. You'll be pleased to know, and I continue to shake hands. And I think it's very important that we, you know, people obviously can make up their own minds. I think that Matt has said that people must make up their own minds, but I think the scientific evidence is, well, I'll hand over to the experts, but our judgment is wash. Washing your hands is the crucial thing. Yes. Before you shake hands.
Hi, I'm Ashley Furlong from Politico. Is the Health Secretary meeting with EU health ministers to discuss the situation? If so, what sort of coordination is being discussed? And secondly, could you confirm that the UK will not seek continued access to the EU's early warning system for for situations such as these in the future?
Well, thanks. We continue to have a global coordination that you would expect, and I congratulate the Chinese authorities actually on the speed with which they posted the news. If you look at the speed with which they posted the news of an outbreak that has had serious international implications, and I'm getting the signal from the back that. I'm going to take 2 more questions, and then if that's okay, we're going to 3 more questions. 1, 2, and then you're yes.
Thank you, Prime Minister. It's Kate Proctor from The Guardian.
Yes.
The advice and the suggestion that cities could potentially be locked down to try and contain this, is that advice now no longer a likely course of action? And secondly, I wanted to be very clear from the Chief Medical Officer, the mortality rate of 1%, you did suggest it would be higher for the elderly. Could you tell us what that figure is?
Well, I think you should probably answer both. On the lockdown necessity on mortality, yes, absolutely.
So the Health Secretary has been really clear that there are multiple options that can be looked at, ranging from ones which have huge effects or large effects and very small implications for individuals, washing their hands being absolutely top of the range, through to ones that may have very big social effects and much less implications. And what we presented to ministers, as Patrick said, is a combination of those modelled out scientifically to work out what are the right things to do. In general, though, and I don't want to take any clear thing off the table because it's important everyone thinks this through, the locking down a city is most useful when it is starting in one place with a high transmission in that place and nowhere else. And it seems unlikely we'll be in that situation in the medium to long-term future. But it's important that all the options are available to people. What was the second? Around the 1%. So I think that the Chinese authorities have very helpfully laid that out, and in fact the Times newspaper did a nice graphic showing the Chinese data this morning. The first thing to say is there are some questions about exactly how you calculate mortality, and I don't want to go into that. It's a pretty technical area on this. But I think what is clear is that there is a significant ramp up in the risk of people dying with this infection once they get over 80. And it begins to take off a bit earlier than that. But the exact percentages will depend on a lot of factors, including the healthcare system you have in place. So I would not expect, and I don't think Patrick would expect, the numbers we're seeing in China automatically to read over to the UK. And I think what we'll get is more data probably from European systems which will be more comparable to our own fairly soon. And we're very happy to update things once we have those.
Thanks very much, yes.
Prime Minister David Hughes from PA. We know that you're considering emergency powers. Could you give us a sense of what kind of powers you are considering? And given the age of veterans and the wartime generation, will VE Day commemorations have to now be scaled back?
Okay, well, thanks. On the second point about specific events, we're still, as I say, in the contain and research stage of this. We haven't taken decisions on specific events as we've been discussing just now. And on the powers issue, very, very important for everybody to understand that yes, it is necessary to have some legislation in respect of things like school operation, borders, quarantine, but these are exceptional and short term, and they're not intended to last beyond the outbreak. Anything you want to add on that? I think the last question, yes.
Thank you. Laura Macon-Isherwood from Forces News. It says in the document that the Ministry of Defence has put in place plans to ensure delivery of its key operations in the UK and overseas. Are you able to expand on what those operations are and what the risks might be if you've had to ensure they can be delivered?
Laura, alas, I'm not going to expand now on what those operations are, but I can tell you that insofar as is possible, the MOD, our armed services, our police, and all our public services will be going about their business in the normal way. And I just want to bring this to a close, if I can, just by recapitulating the four essentials of this plan. It's contain, delay, research, and then, if necessary, mitigate. I hope it's been useful. I want to thank particularly the Chief Medical Officer, Chris, and our Chief Scientific Officer, Scientific Advisor, Patrick, for I think what has been a very, very clear presentation of the assessment of the risk and the steps that the government proposes to take if those risks should transpire. Thank you all very much for coming on this morning. Thank you.